Good evening and welcome to Tuesday's programme. Tonight we continue our look at the rise in children diagnosed with mental health problems, with a warning that up to a fifth of primary school children have been affected at least once.
I know, it's almost unbelievable, isn't it? But a report by the charity Centre for Mental Health looked specifically at 11-year-old children, and that found that 1 in 10 had a mental health problem, according to their parents. And it showed that boys are twice as likely as girls to be suffering. Poverty has an impact, with children from the lowest income families 4 times more likely to have mental health problems than those from the highest earning backgrounds. Well, I've been to one primary school which believes spending time and money on pupils' mental health is essential.
So all those connections you've got in between each other are strong enough to support somebody, strong enough to nurture somebody.
This is circle time at Warren Hills Primary School at Colville in Leicestershire. Children are encouraged to talk about their feelings and taught relaxation techniques.
And out through your mouth.
Supporting children's mental health is a priority here.
If a child isn't feeling stable, if they're feeling angry, they're feeling sad, they're feeling depressed, how can they learn?
Feelings and your emotions are all over your body and in your mind.
Unfortunately, there's a lot of issues that impact our young people. Children as young as 5 and 6 having low self-esteem. We see right through to the older children where we've got sometimes self-harm issues, eating disorders, suicidal ideation. It's actually quite scary.
By the time they leave primary school, 20% of children will have experienced mental health problems at least once. But what's causing this rise in children so young?
We've got much more unemployment, our economic position is much worse than it was, so kids are going to pick up on that. They're going to pick up on the pressures and the stress that exists within the community that they exist in. There'll be some elements of social media within that, but it's a real travesty, isn't it, that we've got kids at that age who are coming forward and saying that they're not coping so well.
The children here are learning how to share their worries.
I get worried about SATs.
It worries me about getting things wrong.
What worries me when people are fighting and when they get hurt.
I could get bullied at big school.
I worry that when I go to secondary school, all of my friends will want to hang around with other people and I'll have to try to find new friends.
Warren Hills funds this specific nurture class and its teacher. There are emotional literacy support assistants, and the charity Place to Be comes into the school 2 days a week to give children one-to-one counselling.
Such a rise of mental health issues in all schools, primary and secondary. We notice it more so in primary, and we feel that there is a need to have support within schools because the services are so stretched that can normally support us, that we have to have that support coming in.
But all of this extra support comes out of the school budget.
We've recognised how important this is, so we have to find the funds. We are very creative in the way we do things, but ultimately it is a cost. But we find that it's so important.
Statistics show that early intervention like this does have positive results.
I strongly believe that if we get it right at grassroots, right at the bottom, it prevents the snowballing effect. So that is testament to the hard work and the benefits that you get from a counselling service and also a nurturing school.
Give yourselves a round of applause. Do a good job today.
Well, we saw there that Warren Hills used the counselling charity Place to Be, and joining us from there now is Debbie Horn. Thanks very much for coming in. First of all, why are we seeing children so young suffering from these kind of mental health problems?
I think we're seeing them so young now because we focus a lot more on that area. Great campaigns such as Heads Together, which I'm part of, our organisation is part of, is really highlighting mental health at the moment and children's mental health within that.
So awareness is raised as well,
Absolutely.
But is there more prevalence as well, would you say?
I think that's an interesting question because there will be certain areas that might kind of promote that, such as social media, for example. We know that children may suffer with low self-esteem. Social media also has a great impact as well, though.
Now, you work with 300 primary schools right across the country. What are the benefits you see of early intervention, particularly for the emotional well-being of the child?
I would say we're supporting them with their resilience, their coping mechanisms, their coping skills, strategies in order to prepare them for later on in life. We know that 1 in 4 adults potentially end up with mental health issues. Half of those usually have symptoms before the age of 14.
And if money is spent then at an early age, do we see that there's a financial benefit down the road?
There is research to demonstrate that, so we would kind of maybe look at that in more depth, but there's definitely research to show that, yes, we would be supporting and saving finances.
And obviously having organisations like yours coming in has all these benefits, but it costs money, doesn't it? So, and schools are already stretched. So, you know, what needs to be done to try and make sure that you can give help where it's needed?
So as an organisation, what our hopes would be that every school has access to evidence and research-based mental health. What we could do is maybe work a bit more flexibly around that, support teachers in training and mental health so they can create strategies to take back into their school to support our children.
OK, Debbie, thanks very much for coming in.
Thank you.
And there's more on the well-being of our youngsters later on in tonight's programme.
Yes, because we look at how experiencing the great outdoors could help children's mental health and improve their learning.
Also, the National Forest Project taking the classroom outdoors. Welcome to Forest School.
Now, a group of school children in Leicestershire are swapping the classroom for a tree-lined canopy to learn practical skills like shelter building, as well as knot tying, cooking and exploring their environment.
Sounds fun, doesn't it? Now, it's been funded by the National Forest as part of a project announced in the Commons to get every primary in the forest using the outdoors to support their lessons. Research shows it can have huge physical and emotional benefits. Elise Chamberlain reports.
Under a canopy nestled within the trees, this is where some of the students at Ibstock Junior School are learning. For a few hours every week, the children head outside for Forest School sessions to learn about the environment and how to use it. The National Forest has helped to fund this as part of a project called Forest for Learning.
Children take a lot back to the classroom, such as resilience. They have worked better together in the class. We've built relationships based on what's happened out in forest schools. Also, there's a lot of cross-curricular links as well, so there's a lot of math skills involved with knots. There's lots of science elements, so we learn about different species.
It gives you a chance to get outdoors and have fun. Sometimes a bit scary, but at the same time it's really exciting. In this one you actually get to like build things.
The National Forest, which stretches over 200 square miles in Leicestershire, Derbyshire and Staffordshire, is aiming to be the first area in the country where every school child experiences outdoor learning.
There are 88 primary schools, and so we've got 36 now doing regular outdoor learning, and our aim, well, our long-term aim within 5 years is to have every child within the National Forest doing regular outdoor learning.
As well as teaching the children some really practical skills, staff here say they've also noticed a big improvement in the children's confidence and their creativity.
Engagement levels are really high, and you can see that from how the children are. The self-esteem levels shoot up as well. We've got children that might not necessarily be successful academically, but they can be successful outside.
We want this next generation of children to learn about the forest, to engage in the forest, to have an ownership of the forest and to enjoy it, so that as they grow up, that it's a part of them, it's a part of their life.
Elise Chamberlain, BBC East Midlands Today, in Ibstock in Leicestershire.
It's such an important subject, and that's why we've been talking so much about it this week, isn't it?
Yeah, and experts say that, you know, teaching children in this kind of way, you know, getting out of the classroom, you know, don't test them all the time, really helps their mental health. So stuff like that is good to see, isn't it?
It's nice to see it kind of incorporated in their everyday classes.
Yeah, yeah.